Hello, I'm Dr. Nabil Sanadi. I'm a board-certified emergency physician. I'm a founding member of the South Florida Fire Rescue Medical Directors Association, SFREMDA, and you can find us on www.sfremda.com. Welcome to the Medic Minute. We have seen a rise in the use of heroin in South Florida. Most recently, Philip Seymour Hoffman passed away from an overdose from heroin. An amazing set of events. Basically, the pill mills, Oxycontin, has become so expensive that people are falling back on using heroin. And the trend is multiplying and more people are using it. And as we've seen in the media, the high-profile death actually multiplied the awareness that heroin is available and is inexpensive. Heroin is a drug that works on the central nervous system. It's easily absorbed, and it works at the neurotransmitter level where it creates the state of dissociation. There could be a sense of discomfort, however, the person does not care that they have the discomfort. Same as morphine, or very similar. And what it does, it actually creates this aura, this euphoria, this sense of painlessness. It creates a general sense of warm, fuzzy comfort for the individual that uses it. The drug is very addictive, and it has immediate effects, especially if it's injected intravenously. Street names for heroin: H, smack, black and brown tar, horse. It's a very dangerous drug. It could be injected, it could be snorted, free-based, or it could be inhaled. Very dangerous, very addictive, and easily absorbed through the mucous membranes. As a pre-hospital provider, boots on the ground, first responder, as a paramedic or an EMT, when you respond to a patient that overdosed on heroin, they will be pale, hypotensive, tachycardic. They will have snoring respirations. They will have a slow respiratory rate. Their O2 sat will be low. They'll be hypoxemic, hypoventilating, and they'll be on the verge of having a respiratory arrest. This is the time to catch them, save their life, manage their airway, increase their O2 sat, support their circulation. Of course, using antidotes. Narcan will help. Of course, as a first responder, when you respond to the scene safety is very important. Your personal safety is also very important. The key point or the key element to keep in mind as you're responding to a person that may be an overdose victim on heroin is that they may have sharps in their pockets that are uncapped. There may be sharps on the ground. If you stick yourself with that person's blood, the risk of infection with HIV, hepatitis B, hepatitis C, any of the other diseases is very real. You don't know where that person got the needle, how often they've used it, who used those needles other than that one individual that you're responding to. So you have to be ultra cautious. You could be a victim also. One of the things that you need to look for around the victim is the possibility of them consuming more than just heroin. The newest trend is that fentanyl and heroin combined. Packets that look like Theraflu or are labeled Theraflu may have the combination of fentanyl and heroin. Fentanyl is 100 times more potent than morphine. So imagine the combination of two sedatives that can actually drive the respiratory drive to zero and have the patient have a respiratory arrest. So ultra caution as far as drug mixtures, heroin and something else, and now the more prevalent heroin-fentanyl combination.